Poso maoni wiak, waiwanan kitana ni mua e yoski piataya posnotaman e yum MITW Podcast. A yospis piataya posnapi notaman and e hisikimaka e yoso matnameneha kihi.
Poso, you're listening to the Menominee Indian Tribe of Wisconsin podcast. I'm your host, Sheena Wapus.
And Gary Dodge.
Today we have Vaughn Bowles, Public Information Officer for the Menominee Indian Tribe of Wisconsin, joining us. Welcome, Vaughn.
Good morning.
So, Vaughn, the Omicron, I think that's how you say it.
Yep,
I can't remember the last. Okay.
Close enough.
That seems to be all over. So how widespread is Omicron in the U.S. at this point?
Right now it's not too widespread. It only makes up about 2.9% of the cases according to the CDC. Delta still makes up the vast majority. It's 96.7% of our cases and stuff. That could change. It most likely will change, but that's where we're at right now.
Okay, so on the news, they said that Omicron is spreading like a wildfire in other countries. Would our healthcare system be able to handle another massive outbreak right now?
So it's kind of a difficult question, and there's a lot of reasons for that. Unlike a lot of European countries, let me start with that. Each of those countries has their own health system with a wild variety of abilities to compensate or cope with COVID, and it's kind of the same thing here. Like, depending on which state you're in, you might receive drastically different medicine. The doctors have different agreed upon practices and stuff. It's really interesting. Anyway, so there's that component, but there's also the component of like urban versus rural here in the U.S. that's pretty prominent. In 2019 we had 47 rural hospitals, or hospitals in general, closed across the country, and we lost another I believe it was 27 in 2020, and that was due to various hospital shutdowns, loss of staff, things like that. And it doesn't sound like a lot, but when you have to petition the federal government to open a new hospital, that can be pretty problematic in some cases. So locally here in Wisconsin, though, we've done really well. We've only lost one rural hospital since 2005, which is fantastic compared to a lot of other states. We're actually third in the nation for the fewest number of rural beds lost. Right now, DHS says that 93.4% of our hospital beds are in uses, which is a little higher than normal. Usually it hovers around the mid-80 mark. Similarly, our ICU bed is at 95.7% capacity statewide. So that is higher than normal, and that is due to a lot more COVID cases. It doesn't leave a lot of room for a major spike, but we do have a little bit of wiggle room. But we obviously don't want people going to the hospital with COVID cases. So that's why we're still promoting vaccinations, hand washing, masking, things like that.
Okay, and that's what I was going to get to. I was going to say, what can we do locally to help prevent a large outbreak of Omicron?
It's kind of weird. So with all of the variants and stuff, we want to say get vaccinated. That definitely helps. But they're finding a lot of it is prevention and lifestyle at this point. So getting plenty of sleep, maintaining a proper diet that allows you to have sufficient levels of vitamin C and D, exercising on a regular basis, frequent hand washing, washing of contacts like high contact surfaces, and avoiding large crowds. Those are the main things that prevent these large outbreaks that they're worried about at this point.
All right. I also read that Menominee County is 78.5% vaccinated. Do we know how many have gotten their booster shots?
We do. Yeah, we've actually done really good. I just got new numbers updated yesterday. I was all excited because I'm a nerd. So we've had 1,238 people get Moderna boosters, and another 62 have gotten Pfizer booster shots. Year to date, we've given out 11,863 COVID vaccinations. And as far as like new vaccinations go, 3,900 people have received their second Moderna vaccine this year. 849 have received their second Pfizer, and 238 people have received Johnson & Johnson shots. And then as far as like the push with the child vaccination has gone, we've had 367 that have received at least one vaccination and 243 that have received 2 doses. So we've done really well at getting the vaccine out amongst the county. And you can really, or we believe that it has strongly impacted how COVID's reacting locally now, because we have the lowest case rate in the state, which is fantastic and very, I think, very impressive.
So at this point, we have the booster shots. What does it mean to be fully vaccinated? Does that mean 2 shots or 3 shots at this point?
Yeah, that's kind of a moving target depending on who you're talking to, and depending on which organization they're working with. So right now, it's predominantly the 2 shots or a 1 Johnson & Johnson shot. But if, going to throw in that caveat there, if you've had it more than 6 months ago, it's strongly encouraged to get a booster shot to be considered fully vaccinated, according to the CDC.
Okay, so I know we don't know that much information, but right now, do we know if any of the vaccines perform better against the Omicron variant than others do?
Moderna has had the best success against it so far. Pfizer's coming in second, and Johnson & Johnson is kind of their third. Kind of like how it's been the entire time, actually.
Okay. So if Omicron doesn't seem to cause a more severe disease so far, why are doctors still concerned about it?
They're mainly worried about those vulnerable populations. In this case, like the elderly and the immunocompromised. Those are at risk of, the most severe cases and possibility of death. So they're looking at not a per capita rate, just like a total numbers rate at this point.
Okay, in the past, you've talked about the virus possibly becoming less and less severe as it mutates. Is that what we are beginning to see what happened with Omicron?
That's what it's looking like. They're still bringing in more data on that, though. So jury's out, but it looks like it right now. Yeah.
So maybe we're getting somewhere.
Yeah, and it's kind of funny because we've had what are known as leaky vaccines and stuff. We've had breakthrough cases and things like that, and so it's actually caused a lot of mutations and stuff of the virus. And there have been some people that have postulated that, perhaps the Delta variant is actually going to be the best form of vaccination because it's not very severe. It spreads quickly. So everyone, in theory, could pick up antibodies from it fairly quickly and with, fairly minimal risk. So there are some people that don't like that.
Delta or Omicron?
Yeah. Sorry, Omicron, not Delta.
Yeah.
Omicron.
Okay.
So there are some people that don't like that idea because you're letting people get sick, but the likelihood of it happening is pretty good at this point.
Well, maybe it'll just get even more mild as it mutates.
That'd be fantastic, and hopefully it does, yeah.
Okay, so Vaughn, did you have any final message for people before we leave? We will not be returning with another episode until January 7th, by the way.
We want to thank everyone who's participated in our vaccination program this year. Really appreciate all the help that, you guys as a community have put in to try and keep everyone safe and healthy. And so, wishing you guys the best for the holidays. Merry Christmas, Happy New Year. Stay safe. Don't kiss strangers. And we'll see you next year.
Thank you, Vaughn.
You bet.
Waiwanan for listening to the Menominee Indian Tribe of Wisconsin podcast. You can find us on Apple Podcasts, Spotify, and Stitcher. You can also listen to the podcast on menominee-nsn.gov under the Community tab. Keep up to date by following us on Facebook at MITW Podcast. If you have any topic suggestions or questions about COVID-19, you can send those to us at podcast@mitw.org.